Hello, my name is Runcie Chidebe. I'm a patient advocate and the founder of Project Pink Bloom. Looking back on my experience at ASCO 2026, I would really say a major takeaway for me, it's really about seeing collaborations. I see more patient advocates getting involved in research, partnering with scientists to drive progress and innovation in oncology. I think that is really, really important. I'm thinking about some tremendous amount of research and data that had come out of this year's ASCO and some key development or insight I think the Global Colon Cancer Association members around the world might be interested in. In my estimation, I would say about four data or four research were really, really interesting to me. The first is what is really from Circulate trial, which is about using a blood test to make post-surgery decision. Presently, what we know is that after a colorectal cancer surgery on a patient, the healthcare team want to know whether there is still any sign of cancer cell in the patient body, right? So, circulating tumor DNA, which is also known as ctDNA testing, uses blood sample to check whether any traces of cancer remain in the body. If the result is positive, it means that cancer is most likely to return. If the result is negative, that's a good sign, right? Although there is no guarantee that the recurrence will not occur. So this study by Forprecht and colleagues reported a phase 3 randomized clinical trial with about 1,396 stage 2 colorectal cancer patients. They conducted this study in 138 sites across Germany and Austria. They actually assigned stage 2 colorectal cancer patients who had completed their surgery to chemotherapy or even observation based on their ctDNA results. If this finding really proven to improve outcome, then I think that this finding could really change or really help the healthcare team who use ctDNA to identify who is most likely to need chemotherapy after surgery and who they could just safely observe. Number 2 for me is the Breakwater trial. This is a data about the combination of BRAF inhibitor and EGFR inhibitor with standard chemotherapy. What we know is really about 10 to 8% of colorectal cancer patients carry the BRAF V600E mutation, which is really more aggressive. So Coppert and colleague did a randomized control trial with about 147 colorectal cancer patients for the combination of the BRAF inhibitor as well as the EGFR inhibitor with standard chemotherapy on the side also as a control. Their findings showed that the combination really had clinical, meaningful, and statistical significance. Number 3 for me is the Challenge trial. The Challenge trial, really looked at the cost-utility analysis of phase 3 trial. Calvin and colleagues randomly assigned colorectal cancer patients who had completed chemotherapy to a 3-year structured exercise program or health education material. The cost-utility assessed the incremental cost, incremental quality adjusted life years, and incremental cost utility ratio, right, of really those patients who were recruited to be part of the structured exercise program. They did this research, from the perspective of the public healthcare payer, and they recruited about 889 colorectal cancer patients. The finding of this study actually showed that structured exercise program was less costlier and even more effective, saving the healthcare payer over $1,500. Number 3 for me is the SOLAR trial, which is the use of blood-based tests for colorectal cancer screening. What we know is that hundreds of millions of eligible adults remain unscreened for colorectal cancer. In fact, in many low and medium income countries, screening is less than 10%. There is currently no national colorectal cancer screening in many countries of the world. So people only screen when they have symptoms, right? So this study by Asgarian, and colleagues presented a study evaluating the use of blood-based tests for colorectal cancer screening. Their preliminary findings are promising for colorectal cancer screening community. Currently, according to the clinicaltrials.gov, they have about 29 active, study sites across the United States. Right. So what does this mean to me, and what does this mean to Global Colon Cancer Association members around the world? I think a blood test for colorectal cancer screening would be a game changer. It would be easier and even be more convenient for people to get tested. An increase in colorectal cancer testing is most likely to lead to earlier detection, which will translate to greater survivorship. So I think there is an urgent need for researchers to consider including lower income populations, such as Nigeria, in this current trial. I strongly believe that global equity in colorectal cancer should not be limited, to the validation of this intervention, but also at this development stage. I also think that, while all this evidence, including the evidence about BRAF and all the rest of them are very, very important, I also think that the biggest problem is that even for BRAF mutation, for instance, is largely limited. Testing for that is largely limited because most of the low-income countries really rely on IHC, that's immunohistochemistry, and really NGS panels and stuff like that are really largely limited. Okay, so I just wanted to also say that my own advice to patient advocates and the community leaders who are interested in attending ASCO next year is that it's important that everyone knows that ASCO provides travel grants every single year, and these travel grants are open for anyone to apply. So my advice to patient advocate, patient and community of leaders is really to first of all get involved in advocacy in your community, do the work, get involved, and let your work speak for you. Contribute to the community through different ways that you could. By this way, you could use those stories to apply for ASCO travel grant, and through the generosity of ASCO, you may receive the scholarship and have the opportunity to come and connect with patient advocates and scientists who are changing the landscape of colorectal cancer around the world. Thank you so much.